Welcome to Mental Health Mini number 3, where we will discuss the interdisciplinary team in mental health care. The interdisciplinary team focuses around the patient as we practice patient-centered care. Different members that we'll talk about today of the interdisciplinary team includes the RN, a psychiatrist, a psychologist, a social worker, occupational and recreational therapists, mental health tech, the family members, primary care providers, a psych PA, and a psych NP. The providers consist of our physician practitioners as well as our non-physician practitioners. Our physician practitioners include our psychiatrists, our psychologists, and our primary care providers. The psychiatrist can prescribe medications, conduct therapy, and determine competency, and they are educated at the doctoral level with residency training. A psychologist is more therapy-based and cannot prescribe medications, but can still guide treatment for a patient. Then the primary care provider is responsible for ruling out any medical causes and monitoring any physical function that may be affected by psychiatric treatment. Our non-physician practitioners is a psychiatric nurse practitioner. They can also prescribe medications and conduct therapy and determine competency. However, they may or may not be required to work underneath a provider. They are specifically trained in the care of psychiatric patients. A psychiatric PA, however, is generally not specifically trained in psychiatric nursing care, although they can still prescribe medications and conduct therapy. They must work under another provider. The care coordinators are the registered nurse and the social worker. The registered nurse may or may not be certified in psychiatric nursing, but they often work in a psychiatric nursing setting. They are responsible for the care and coordination of a patient's care to optimize health outcomes of those diagnosed with mental illness. And their practice focuses on interdisciplinary collaboration, counseling and nursing interventions, discharge planning, care planning and coordination within the hospital, advocacy, crisis management, and they can also lead certain groups like education groups. The social worker may be licensed as a licensed certified social worker, or they may be unlicensed, but educated. They are responsible for the creation of a treatment team and plan to optimize the health outcomes of those diagnosed with mental illness, and their practice focuses on therapy and counseling, discharge planning and coordination, care planning and coordination both in and outside of the hospital. So they're going to be responsible for the community referrals and coordination. They also are responsible for advocacy, crisis management, and group therapy. The therapy staff also includes occupational and recreational therapy. Occupational therapist focuses on the improvement in performance of ADLs, and their therapy is focused on building fine motor skills, gross motor skills, scheduling, home support assistance, eating, bathing, cleaning, and anything else that may be helpful in allowing the patient to conduct their ADLs and live as independently as possible. Recreational therapists create activities to help develop skills, knowledge, and behaviors. They run different types of group therapy like art therapy, music therapy, play therapy, and outdoor therapy. The support staff includes clergy, mental health techs, and the family. Clergy is often from any religious background that the patient prefers, and they help guide the patient through spiritual conflicts, enhance their spiritual practices, and can comfort and guide them through the grieving process. Family is going to be very important in the healthcare team as they help make decisions for patients, especially when the patient is incompetent. They help the patient in both care inside the hospital as well as outside of the hospital. They're going to be responsible for helping with any coordination of care because they know what the patient's capable of. They know who's able to get patients to appointments and so on and so forth. They can also provide emotional and social support for the patient, and they're key to gathering information on the patient's experience and symptoms. Then the mental health tech is somebody that works closely with the nurse to support the patient in performing their ADLs and going about their day-to-day activities. They're also going to be helping to monitor the patient for safety, and they're going to be working with the nurse to ensure care delivery. They can provide compassion and social support for that patient as well. In addition to the roles that we talked about, we may see other roles involved in the interdisciplinary team, such as a nutritionist and anyone else that's going to be involved in the patient's care. And that concludes our discussion of the interdisciplinary team.